Good morning, and thank you for joining us for this webinar on COVID-19 guidance for early learning and care contractors. This webinar is being presented by the California Department of Education's Early Learning and Care Division and Fiscal and Administrative Services Division. This morning's webinar is being held on March 5th, 2021, and is scheduled to run from 10 a.m. until 11 a.m. I'd like to thank you for joining us this morning. My name is Stephen Profner. I'm the Director of the Early Learning and Care Division at CDE. Since our last webinar, many things continue to happen at CDE. As you know, particularly in this year, things are fluid and sometimes changing, and we're doing our best to keep up with those changes and make sure that you are informed as well. In the coming weeks, we'll be releasing multiple management bulletins to address items related to Assembly Bill 82, as well as one on the program self-evaluation. We'll be discussing those a little bit more this morning as part of our upcoming guidance. But speaking of management bulletins, the next round that you all will see and moving forward will look a little different than what you may be used to. We've heard from many of you for some time about the layout and presentation of information in management bulletins. And more recently, last Thursday on February 25th, stakeholders at our CSPP listening session were asked how CDE can address administrative burden on CSPP programs. So one of the highest selected options in that poll was to redesign management bulletins to make them easier to interpret and implement. So we know that the different stakeholders use the management bulletins in different ways. We need our guidance to be clear to contractors, but we also want them to just be clear and understandable to just the field at large, all of our stakeholders. We are launching a new structure for management bulletins, and we vetted this structure with a small group of contractor and external stakeholders, and believe that what you all will see will be an improvement to our management bulletins. We're going to be rolling out this structure over the next few months, and we'll ask for your input again on how we can continue to improve the management bulletin communication. And we're also anticipating sending out more information specifically about the organization layout, et cetera, to subscribers of our distribution list shortly. Coming back to other COVID items, we know that many of you are working in programs that are open and are exposed to risk every day. We are grateful, appreciative to hear more good news every day, it seems, on vaccine rollout, vaccine distribution, the goals that we hear from the federal administration, state administration on getting vaccines out. We saw in Assembly Bill 86, which hasn't been signed just yet. It was passed by the legislature, and it requires that 10% of the first doses of the COVID-19 vaccines will be made available to child care workers and or folks in early learning and care, as well as in education. So we're excited to hear about that. So we know there's light. There's light at the end of the tunnel, and so that's really encouraging. And before I hand over to Erica for some opening remarks, I just coming back to appreciation, always coming back to appreciation for everything that you all are doing to support children and families. It's not easy, and we thank you from the bottom of our hearts. And with that, I will turn it over to Erica.
Good morning, everyone. Happy Friday. Thank you, Stephen. Erica Otiono, Associate Director. Before I get to the activities of the Program Quality Implementation PQI Office for today, let me take a moment to let you know that we are so appreciative of everything you have done and have continued to do for your staff, providers, children, and families. Encouragingly, the COVID-19 cases are declining and vaccinations are ramping up for early childhood educators in our communities. What an exciting news. Please, even in the midst of our busiest days, let's make sure to take a moment to acknowledge and celebrate our accomplishments that we have done during this pandemic. Now, on to PQI activities for today. The PQI office will provide updates just specific to the use of the Environment Rating Scale, ERS, during the pandemic. The update has incorporated some of your oral and email recommendations for the use of the tool for 2020-2021 fiscal year. I'm glad to share with you that even without an executive order, the CDE, ELCD, has designed a process that takes into consideration the pandemic while remaining consistent with the regulation. Roseanne Pitts, one of the administrators in PQI, will provide information on the self-certification form that will be used for this fiscal year, both for program self-evaluation and also for monitoring. So thank you again for joining. I'm now going to give it over to Virginia.
Thank you, Erica, and good morning, everyone. So nice to have you with us all today. I'm Virginia Early, the administrator of the Policy Office in the Early Learning and Care Division. Thank you so much for your engagement with us and your engagement in the Policy Office. For those of you that don't know, my office is lead over working with the administration and the legislature on all pending policy. So for example, we have a big budget hearing coming up on Wednesday this week. And we're also lead on guidance. And so we'll be talking more about that today. So with that, I'm going to turn it over to Alana from my team for who's going to be our moderator.
Good morning, everyone. As Virginia said, I'm Alana Andrade, and I'm a child development consultant in the Policy Office, and I work with Virginia. I'll be moderating the webinar today. And with me, we have a great team answering questions and making our presentation run smoothly. From the Policy Office, besides myself, we've got Danielle Davis, Eric Dunk, and Barbara Lindsay. From the Program Quality Implementation, the PQI Office, that we have Roseanne Pitts, Crystal Devlin, Deborah Rawson, Lupe Lopez, Cassandra Lewis, Brittany Sheffield, Fear Zong, Richard Miller, Serene Yi, and Katina Boulay. From the Child Development, Nutrition, and Fiscal Services Division, CDNFS, we have Corey Kahn, Andrea Johnson, and Alan Lynch. From the Child Development Management Information System, CDMIS, we have Robert Hom and Carly Nodahara. And here to answer any questions regarding nutrition or the food program, we have Shashi Sharma. And as every webinar, our team is committed to being as responsive as possible. And just to reiterate, our team won't be able to answer every question that we receive. We do appreciate being able to engage with you in such a quick and responsive way. Also to note, our chat box is disabled. We will be sharing links with you there, but you are unable to chat with us. So please utilize the Q&A feature to ask your questions. And back over to Stephen to review the agenda today.
Great, thank you, Alana. So as you heard from Alana, we have a very full team, a great team on this webinar to address your questions and also to help us prepare for today. There's a lot of prep that goes into these webinars to make sure that we are as responsive as possible in getting the information that's needed, getting any information out that that we can. So I always enjoy these webinars. I get to work alongside this team even more deeply and engage on these Friday webinars. So as we normally do in today's webinar, you're going to hear about policy and program quality implementation updates, as well as some critical fiscal updates. We'll also review some questions that have come in from many of you recently. We're hearing a lot of questions related to some of the provisions in Assembly Bill 82, naturally, which we'll be addressing in part this morning. We're going to do our best to get to as many questions as possible. As Alana just mentioned, please use the Q&A function in Zoom to pose any questions you have, and this great team will we'll do our best to get answers to all your questions again. So anything we don't get to this morning, though, we will take back to address in FAQs on our website. And I will now move over to Virginia for some policy updates.
Thanks, Steve. Thanks again, everyone. Again, Virginia Early with the Policy Office. So many of you with the passage of recent bills have asked us, why are you talking so much about bills, CDE? We want to know all of these questions about exactly what we're supposed to do. And so we wanted to let you know about some upcoming guidance related to that recently passed legislation to be looking out for. We're still working on it internally. So we did send an email out to the field earlier this week that summarizes, for those that haven't been on our webinars or wanted a refresher, some key elements in the recently passed legislation. And so this is sort of a reminder of some pieces that are in there. So we'll be issuing a management, you see on this slide, there'll be 3 management bulletins. So the first of these management bulletins will be guidance related to the extension of emergency childcare services and new enrollments in emergency childcare services for both essential workers and at-risk populations. So one thing to just be aware of, for those of you who maybe need a reminder, there was $76 million in the bill for extension of emergency childcare and $80 million available for new enrollments. So at this time, please wait for our guidance, which will answer many of your questions. But to give you a tidbit, we know that some of you have been asking, how will this be different or the same as what was done before? Will I still be able to self-certify eligibility? Yes, you will still be able to self-certify eligibility. And so we're hoping to get that one out very, very soon. It's currently in the development process. The second management bulletin we're working on is reimbursement and data collection requirements for alternative payment programs and providers. These are really related to the non-operational days for closures. And so the bill also added an additional 16 non-operational days for the providers being sort of funded by the CAP, CalWORK Stage 2, Stage 3, the CMAP contracts, and then also a total of 30 new days for all of our fetch-in contracts. And so all told, these programs will have a total of 30 non-operational days when we look at the 14 days previously authorized and the 16 new days. So these are for COVID-related closures. And so this second bullet on the slide, we're going to be revising, we're going to be putting out a management bulletin that specifically speaks to non-operational days for voucher programs. The third and final bullet is where we're going to address the non-operational days for our fetch-in programs. And so for that one, for that reopening and reimbursement requirements for those direct service contractors related to the non-operational days for closures due to COVID, we will be revising, we're going to be revising Management Bulletin 2018. So that will be revised, and the 2018 as it stands right now will be rescinded. And basically what we'll be doing is we'll be clarifying our fetch-in contractors will be able to use the benefits that have always been available in Management Bulletin 2018, but now there are these additional 30 days as well. And so the rewrite to the Management Bulletin 2018 will really explain how those two pieces go together as well as continue to provide the same guidance in the other areas. So there'll be a more detailed fiscal update sort of towards the end of this webinar. So we know you probably have a lot of questions about when do I get the money for emergency childcare, and how am I paying for non-operational days and those pieces. So just flagging for you that will be covered. So we look forward to discussing this in much greater detail with you on our next webinar. And we're really hoping to have these management bulletins out very soon. So now I'm going to turn it over to Danielle, who will go into some pieces around transitional kindergarten that we know many of you have already been asking in the chat.
Hi, everyone. So again, we have received a ton of questions from the field regarding TK and CSPP age eligibility and where they meet in between. So we wanted to let you know that some additional questions have already been posted to the FAQ page. So if you go onto the COVID-19 webpage and pull up the FAQ tab, you'll be able to see those new questions regarding TK age eligibility and with the answers there on the website. We also wanted to answer some of the most frequently asked questions that we're getting on this webinar today. So I'm going to go through just a few questions for everyone. The first one would be, some families want CSPP instead of transitional kindergarten. So why wouldn't we enroll those families in CSPP now? So we understand that there are a lot of families that would prefer to keep TK eligible children enrolled in CSPP. However, beginning July 1, 2019, the California Education Code sections 8208 and AI and AJ for the definitions redefined what constitutes a 3- and 4-year-old for CSPP. So we want to make sure that it is clear that this is the new law that we have in place. However, for this program year, there is direction in Management Bulletin 2104 to allow these TK age children to be enrolled this program year. The next question that we've gotten a lot of traction on is, where can we find information for serving TK age eligible children in CSPP for the 2021 program year? And that is that you can find that information in Management Bulletin 2104. It's important to note that this management bulletin does not just address CSPP contractors operating within the free and reduced price meal boundaries, as many have probably assumed by the title of it, but in fact, this management bulletin actually provides a lot of updates for all CSPP contractors, and so it should be followed by all CSPP contractors and also includes that provision that will allow TK age eligible children to be served this program year. Let's see. Oh, perfect, thanks. So the next question we have is, Management Bulletin 2104 indicates that TK and kindergarten age eligible children may remain enrolled if specific conditions are met. So is the agency required to complete additional documentation to justify this, like a notice of action or a statement from the parents? Like, what's the process? So our guidance is that contractors should document that they have met the requirements in sections 1813.5, D1 and 2, and or sections 18131.6, B1 and 2, depending on if you're a full day or part day. That is the difference between those two sections. So as applicable. So if you're a part day, you'll follow the part day section. If you're a full day, you'll follow the full day section. Families should use self-certifications to document that they have met the requirements in 18131.5 D3 and or 18131.6 B3. So that's the requirement for the parents for either part day or full day, depending on what program their child is enrolled. You can find this information in Management Bulletin 2104. And if you look up those sections within that Management Bulletin in the guidance document, you'll be able to see what those requirements are. And then so self-certification options should be as easy as possible for families. So they can include, but also not limited to, an electronic form, sending an email or a text message. Any documentation from the family should be kept in the family data file though. So let's see, we've got some more questions. Let's see, so can children in full day CSPP that are TK and kindergarten age eligible remain in CSPP until September 30th? So for full day CSPP, children can remain if they were enrolled prior to June 30th. They are able to remain in CSPP until September 30th. Can Part Day CSPP children that are TK and or K eligible remain in CSPP until September 30th? And the answer for this question is no. And the reason being is that children in Part Day state preschool are only provided services through the end of the program year, and then the family must initially certify for services for the following program year, meaning any services after June 30th are requiring the family to initially certify for Part Day, and that family would not be able to meet the age eligibility requirements for state preschool if they are certified. So that's why full day children can stay until September 30th and Part Day children cannot, because they aren't able to be initially certified again. So the next question that we have on the slides, we have also received some questions that they're not specifically related to TK and or CSPP, but we do have some questions and a request for clarifications from the field that we've been hearing a lot about and then we feel need to be addressed. So the first one is, when elementary schools begin to reopen, are LEA contractors required to open early learning and care programs at the same time? And per our frequently asked questions that are on the website already, the answer is yes. Once the LEA or the state or local public health agency decides that campuses are safe to reopen, the programs on the LEA campuses must physically open as well. Let's see, the next question is, after the transfer of childcare programs to the Department of Social Services, will state preschool still be required to be licensed? So the answer, we've heard this a lot come up in the wake of the news about the transition and what happens to state preschool after the transition. So we want to be clear here that yes, state preschools are still going to be required to be licensed after the transition. We have not at this point seen any proposal that we are aware of that would change this licensing requirement for state preschool programs. So again, at this time, we have not seen any proposals that would change that licensing requirement. So please do not drop your license and think it's okay to just be unlicensed because you're a state preschool program after July 1. We want to make sure that if you are supposed to be licensed or currently required to be licensed, you remain licensed come July 1, and we will keep you updated if any new guidance or any new proposals actually pass that say you do not have to be. We will keep you updated on that. But as far as it is right now, we want to be clear that there has been no proposal to change that. So you would still be required to be licensed. And then we've also heard a lot of concern about which regulations to follow after the transfer. It's brought up a lot of questions about if contractors are moving to Department of Social Services, are they still required to follow Title V regulations? Do those regulations still apply to their contracts? And the simple answer is yes. All Title V regulations will remain in place and be applicable to contractors at both CDE and the Department of Social Services until the Department of Social Services adopts separate regulations. And it's important to note that the regulation process can be very long. However, there is a statutory requirement in the current transfer language and statute that says that CDE and the Department of Social Services are required to adopt separate regulations no later than December 31st of 2023. So that gives you some sort of timeline of when to expect at the latest that new regulations will be applicable to these programs. But as far as July 1, does any of that change? The answer is no. You will still be required to follow all the current contract requirements of Title V and the statutes that apply to these programs, even though you are moving to, some of those contracts are moving to the Department of Social Services. So we hope that answering some of these questions on the webinar today has been helpful for everyone. But as always, if you have additional questions, please put them in the Q&A. I see a lot of questions have already come in just in the short time that I've been talking. And we're going to make sure to try to get through as many of these Q&A questions as possible today. However, obviously, that is not always the case that we can get through all of them. So just remember that any questions you put in the Q&A, we are taking back to be able to answer. There's always possibilities that we can take the questions that you're answering and put them on the website as FAQs or answer them here at the webinar every other Friday. So I'm going to pass it over to Roseanne for an update from our PQI team.
Thank you, Danielle. Happy to be here today. I'm Roseanne Pitts, and I am an administrator in PQI for the central section of our state. So today I am giving the PQI update for the Program Quality Implementation Office, and I'm happy to be talking about the Environment Rating Scale Assessment Tool, also referred to as ERS or the ERS tool or the tool. Each of the ERS tools is a reliable assessment tool required by law and used for several purposes in our early learning and care department. We use the ERS tool to complete the annual program self-evaluation. We use it for our program monitoring when we visit your program, and we also use it during QCC or QRIS ratings for your quality assessment. The field has had lots of questions about completing the ERS assessment this year. We know that this is a challenging year, and we are listening to you. Though the tool is still required, we have added flexibility for the use of the tool during this pandemic time, and we've created a self-certification form. Next slide, please. Information available from the Environment Rating Scale Institute, known as ERSI. Their website states that the ERS tools should not be used under pandemic conditions to assess the quality of a program in an official assessment. Even though, again, the requirement is still in effect, CDE is taking ERSI's recommendation and input from all of you in the field and will allow programs with direct service contracts to complete what we are calling the Environment Self-Certification During Pandemic Conditions questionnaire in lieu of completing an entire ERS assessment for fiscal year 2021 only. Environment assessments can and should be used to inform best practices. We know that. If you have already completed an ERS assessment or wish to do the full tool, you do not also need to complete this questionnaire. If you are doing 100% distance learning for the entire school year, you also will not be required to do this self-certification questionnaire or the ERS assessment. The environment self-certification questionnaire is 5 questions that are related to 5 of the subscales from the ERS tools. The questionnaire can be used for any age group. I'm going to ask either Brittany or Eric if they can put a link into the chat that has this questionnaire. If you're not able to access it there, it will also be on the ELCD COVID page that Alana will give you the link to at the end of the webinar. Let me give you an example of one of the questions. The questions are related to, again, each of the subscales. One of our favorite subscales is obviously personal care routines, and that's been more important than ever this year. So our question on the self-certification is, how is your program or providers ensuring that correct hand washing, sanitizing, and disinfecting procedures are carried out adequately? So we just want a little bit of information about how you're making your adaptations and how you're using ERS this particular year if you're open for in-person services. Again, for the requirement this year, you will only be doing it if you're doing in-person services. And the requirement is for you to complete a minimum of 1 ERS assessment, or one ERS, we call it different things. I do apologize. 1 environment self-certification questionnaire for each direct service contract you hold. This pertains to the CSPP, CCTR, CMEG, and CFCC contracts types. If all of your programs, again, are only doing distance learning, then this is not required. The results of your environment certification questionnaire will not be sent to CDE, but will be kept in your file for review during monitoring with your other documents that you create, like your DRDP summary of findings, your parent survey summary of findings, those kind of things. All those things will be kept in your files. You won't be required to send it to us. This year, as Erica had said at the beginning, and I think Steve mentioned it too, we're in the process of working on the program self-evaluation management bulletin. This will be out very soon. We do expect this management bulletin and the process this year to be different than it has been in previous years. We're accommodating for just the way that things are going and trying to make it a little simpler. So more information is going to come. We hope to discuss it at the next webinar. And we do have a training tentatively scheduled for April 7th to go over the requirements for the PSC. We appreciate, again, everything you do for children and families. And now I'm going to turn it over to Corey to provide our fiscal updates.
Thanks, Roseanne. Hi, everyone. So my name is Corey Kahn. I'm a manager within the Child Development and Nutrition Fiscal Services Unit. As Virginia said earlier, I will be going over a bunch of updates related to additional allocations that our office is working on. So the first one is the CDE will be receiving $21.486 million to provide, in Prop 64 funding, which is being provided as an adjustment to the fiscal year 2021 budget. So this funding will be used to support additional ongoing CAP enrollments. So that's in the California Alternative Payment Program. The CDE and Department of Healthcare Services, or DHCS, are in the final stages of completing the interagency agreement, which is required in order for the CDE to have access to these funds. We will provide a little bit more update at our next webinar on when we can expect, or when you as the field can expect contract amendments for this purpose. So then the next update that I have is regarding the stipends, so the per child stipends. So Assembly Bill AB 82 allocated $244 million to provide a flat rate stipend amount of $525 per child enrolled in a state subsidized childcare or preschool program. So allocations were based on the number of subsidized children enrolled in November 2020 using the following data sources. So the first one is for alternative payment type contracts, which specifically are the CalWORK Stage 2 or C2AP, CalWORK Stage 3, C3AP, the California Alternative Payment Program, CAPP, or the Migrant Alternative Payment Program, also known as CMAP. We use the CalWORK's Alternative Payment online reporting system, so the caseload that was reported within that system. And then for direct service contracts, which include the General Child Care and Development Contract, or CCTR, Severely Disabled Program, which is CHAN, the Migrant Child Care and Development Program, which is CMIG, the California State Preschool Program, CSPP, and the Family Child Care Home Education Networks, or CFCC. The CDE used data reported in the November 2020 Child Development Management Information System, or CDMIS, and it was the 801A report. So providers who served children in the month of November 2020 are eligible to receive a stipend. The CDE is aware that some children enrolled in CalWORK Stage 2, CalWORK Stage 3, CAP, or CMAP program may have received care from multiple providers in the month of November, but the November caseload report only reflects that child once. And so contractors should not report these children twice, as it would inflate the number of children served in that report month. And so the CDE is aware of this issue, and we're going to be contacting each contractor over the next week or so to determine the number of children who receive care from 2 providers in that report month. Next slide, please. Okay, thank you. And then to support the administration of these stipends, CDE contractors are allowed a 5% administration fee to address the cost of distributing these stipends to the providers. So the 5% admin fee will be allocated to contractors in addition to the allocation that you will receive to send out to your providers. So stipend allocations will be issued outside of any early learning and care contract. And so contractors will not receive a contract amendment for this purpose. Contractors can expect to receive their allocation in April with additional guidance, or we will also be releasing additional guidance related to the stipend allocation in shortly, so it's forthcoming. This guidance specifically, we understand that many direct service contractors have a lot of questions on, say, how the stipend allocation can be spent. So topics such as whether these funds can be spent on hazardous pay, equipment purchases, staff training, things of that nature will be addressed in this guidance that is forthcoming. And then another allocation that we're working on is Assembly Bill 82 also provided $76 million to extend emergency childcare services through June 30th, 2022 for families currently enrolled in emergency childcare who have been unable to transition into ongoing care, and an additional $80 million for CAP and CMAP contractors to enroll additional children of essential workers, at-risk children, children with disabilities or special health care needs whose individual education plans, IEPs, or individualized family service plans, IFSPs, include early learning and care. And so those children would be eligible for enrollment in emergency childcare. So newly enrolled families in emergency childcare can be served through June 30th, 2022. And the CDE expects to release both of these contract amendments, it's both of these allocations for these 2 purposes in one contract amendment, and we expect to release it sometime in the next couple weeks, so in March. And then this isn't a subsequent allocation per se, but contractors, so in the 2020 Budget Act and amendments provided in Senate Bill 820 had provided an allocation of $62.5 million to reimburse alternative payment program providers based on a child's maximum certified hours of care for families certified with a variable schedule and license exempt part-time care until funds were exhausted. And so contractors were required to determine a way to identify these additional costs in order to ensure that the funds were being tracked used appropriately and tracked when the funds would be exhausted. So it has been brought to the CDE's attention that some contractors have exhausted their allocation that they had received back in September for this purpose. And so we have been, next slide, please. Next slide. Thanks. So we have been working with the administration and the state legislature on the issue of continuing reimbursements to providers at the maximum certified hours of care, given that some contractors have exhausted their funding allocation. An agreement was made by these parties to continue the Senate Bill 820 policy. And so while the CDE works with the Department of Finance to obtain additional funds for this purpose, contractors should continue to pay providers at the maximum certified hours of care by utilizing current contract funds. So the CDE, Department of Finance, and the legislature are working as quickly as possible to resolve this issue. And the CDE will provide additional information as soon as possible regarding the timing of when additional contract amendments can be expected. And then next slide. Thank you. So still on the topic of this allocation, so for paying providers, continuing to pay providers at the maximum certified hours of care, all contractors that have exhausted the funds appropriated pursuant to Senate Bill 820 for this purpose, or those that project to exhaust their allocation, must contact the Child Development and Nutrition Fiscal Services Unit to inform their fiscal analyst of the projected shortfall. So note that allocations will not be provided to any contractor that does not contact CDNFS to provide the necessary data in order to process a contract augmentation. So that's different than some of our other allocations where we're reviewing the data that's submitted and providing allocations to everyone. This one, we need you to reach out to us in order to let us work with you to get a dollar amount on how much you need for this purpose. So that's key. So reach out to your fiscal analyst if you feel like you have exhausted or will exhaust that allocation because you're continuing to pay providers at the max certified hours. So now I'm going to turn it over to Alana. And she will facilitate the live question and answer portion of this webinar.
Great, thank you, Corey. And I also appreciate that photo of the dog. A little levity as we go through all of this important information. So I first want to, there are a lot of questions coming up regarding reopening. And a lot of them are very specific to your specific contract and your specific program. And so they're a bit difficult to answer in the moment. And I know that you all are anticipating new guidance. And so therefore you're asking questions about if things were changing. So what I'd like to do is call on Crystal Devlin to come and just speak to current guidance for reopening and how it's similar. I know I don't have a specific question. I can find a few of them, but I think, Crystal, if you could just speak openly about the current guidance for reopening.
Sure. Hi, everybody. Yeah, at this time, you need to continue following the guidance for reopening that is set forth in Management Bulletin 2018. And we will have updated guidance regarding reopening. However, everything for direct service center-based programs will remain the same. The only updated guidance will be around the non-operational days for FITCHN providers. Is there anything else you need from me, Alana?
That's it for right now. Thank you, Crystal. Okay, so there are also a few other questions that we've had, especially regarding TK and CCTR, and a lot of them, again, are specific to your program. So our staff is trying to answer in ways that would be applicable for everybody. If there are things that are specific to your program, it would be great to reach out to your consultant. So one that I'd like to highlight out loud, I'd ask that Danielle come and speak to this. So there was and we've kind of gotten this question a few different ways. So one of them I'll just read out loud. So will it be permissible to serve TK eligible children under our CCTR contract in the preschool classroom for fiscal year 21 to 22 year?
Hi, Alana. Thanks for sending it back. So just to clarify, the answer is yes, you can pay for TK age children with CCTR funds. We also at CDE do not have an issue with you putting those children being paid with CCTR funds in a CSPP classroom. However, we do want to caution you to double check with your licensing analyst to make sure that your license is allowable for TK age children to be commingled with preschool age children. So that's the only thing we would caution you for. But as far as Title V programs go, we do allow you to commingle those children within the same classroom, and we do allow you to pay for TK age children with CCTR funds. So, yep. Let me know if you have anything else.
Thank you, Danielle.
I'd like to add a piece to that because I answered a question in the chat that I think was then misinterpreted by someone else, and I responded in the chat, but in case there's anyone else that got confused. So someone asked if the child turns 5 on or after December 2nd of the fiscal year that they want to enroll in CSPP, are they eligible to be enrolled in CSPP? The answer is yes. Then someone said, you know, what if they turn 5 before December 2nd? That's where they would not, that's where they would fall into that sort of TK age category. And if they're currently enrolled, keep them enrolled, don't disenroll them, but don't enroll any additional kids that turn 5 before December 1st of I need to pull up the statute, but don't enroll children who are turning 5 before that time period starts. Danielle, maybe if there's something I missed there, you can add that, but I just wanted to clarify my response.
It's always helpful to clarify. Okay, so beyond those topics, there's one question that we had about protocols for substitute teachers. And so I wanted to ask Deborah if she could speak to a response for that. So that the question itself was, what is the protocol for CDE recommendation for use of preschool substitute teachers, and how can we utilize the substitute staff?
Thank you, Alana. So currently there's no protocols regarding substitutes other than ensuring that any substitute teachers that you have in your programs have the appropriate qualifications, immunizations, and so on and so forth. And it's specifically regarding substitute teachers during the COVID-19 pandemic. I'm not 100% sure if there's something, but there might be some guidance from CDSS or even local public health regarding substitute teachers in a childcare center, specific to the fact that this might change your cohort group when you bring in substitute teachers.
Excellent. Thank you, Deborah. So we've also gotten some questions regarding the program self-evaluation and self-certification that Roseanne spoke to. So I have one that I'd like to ask out loud. So I'd either ask that Roseanne or Erica speak to it. So it's a clarification. So for clarification, is the self-certification per contract? For example, one for CSPP, one for CCTR, one for CFCC, or per facility/contact, for example, each provider, each classroom?
The minimum that we're requiring is 1 per contract type. You, of course, can do more if you would like, but for our purposes, 1 per contract type for those contracts that deal with direct services, CSPP, CCTR, CMIG, and CFCC.
Thank you. There are also a lot of questions that are asking about their contract and how it will roll over as some of the programs at CDE will be transferring. I think I can speak to that. We don't have any more information to share regarding that, but once we do, we will share it with the field. Let's see if Heather answers. There are some questions regarding the stipends, and I see that our team is currently answering them in the chat. Let's see if I can pull one up. So perhaps, Corey, can you speak to how will we report the $525 per child stipend if it's not a part of the contract?
So I believe that's going to be coming out and or be addressed, I should say, in the forthcoming guidance that the team is working on.
Excellent, thank you. And then there's also a question regarding what you spoke about, Corey, the payment for maximum certified hours, and then are they retroactively going back to July 2020?
So if contractors should have received or would have received an allocation back in September for this purpose to pay providers at the maximum certified hours. So at some point, providers should have been receiving payment, starting July 1st. If they hadn't and they should have, then yes, you should go back and retroactively pay them. For contractors who ran out of funding, let's say by November, that's one where you should be sure to reach out to your fiscal analyst. They will notify myself, and I will probably be working with you and the fiscal analyst to get more information. And yes, it would be the assumption would be that you would retroactively pay them as well.
Thank you, Corey. So there is another question, and I'd like to either call on Virginia or Stephen, or if there's another fabulous leader who'd like to answer. So the question is, my agency has both CSPP and CCTR. Does this mean I will have 2 consultants? Will I have 2 of everything?
All right, this is Steve. I think this question is something that in terms of assignments, in terms of consultant and analyst assignments, it's something that's still being worked out. Though you will have, though it's most likely that you will have, 1 consultant at CDSS for non-CSPP guidance, questions, technical assistance, and then a consultant at CDE for state preschool.
Thank you, Steve. I know that's a big question on everybody's mind. So there's also a lot of questions about cohort sizing and if those have shifted and if they should get re-looked at. So I'm going to ask that Erica, or perhaps Steve or Virginia, I'm unsure which would be the better. So basically they're just asking, has cohort size shifted and how would they get shifted?
I can take that. So you may recall that the CDE doesn't issue the cohort guidance. Really, the cohort guidance is something that is under the Department of Public Health's and CDSS's purview. We have raised this concern, this question to the Department of Social Services, the community care licensing folks in particular, to kind of see where guidance may be going, particularly as more and more counties fall out of the most or move out of the most restrictive tier.
Excellent, thank you. So I'll see if there's any more, and forgive the noise. I live next to a preschool, so I get to see the heart and soul of my work every day, and you might be hearing them because they're in the yard right now. Let's see, maybe one more before we go to the resource slide, because I know you don't always want to hear my voice. Let's see. Oh, there's also more questions about the annual audit report and if there would be 2 separate ones. So as Steve said, these are things that are being worked out and the field will know as soon as possible. Okay, let's see. We do appreciate such an engagement with everybody just today. Okay, so here's a question about emergency childcare and the voucher program. So let's see if we could either call on Virginia or to answer. So if a family enrolled in emergency childcare voucher program is over income and is not eligible to receive and enroll in subsidized care, Virginia, are you able to?
Sure, Crystal was going to speak to us, where if that was me.
Oh, it's Crystal. Oh, sorry.
So be explicitly addressing that in the management bulletin, but generally speaking, this emergency childcare this is different from the emergency childcare in the spring. For any new enrollments in emergency childcare, they need to meet income eligibility requirements. And we'll be giving more direction on that in our management bulletin. Crystal, is there anything else you want to add to what I just said?
Sorry, I was trying to get unmuted. No, there's nothing else at this time. Thank you, Virginia.
Excellent. So Virginia, I have one more for you, but while we're closing out our hour. So there's some questions regarding an update to a possible hold harmless to continue to the next fiscal year.
Yeah, and so we know this is top of mind for all of you, and it's top of mind for all of us here at CDE. We bring it up almost in every conversation we have with legislative staff and with members of the administration. So at this point, there's still some open questions about what will be in the budget for next year. Like I mentioned, there's a budget hearing on Wednesday in the Assembly, which is a great opportunity if you want to go and share your voice in the public comments, so you can share your perspectives and elevate things from the field for their consideration. And I know that this item around the hold harmless is going to be a major part of the discussion. But at this point, nothing is for sure yet, and there's still ongoing discussions.
Excellent, thank you. So while our team is continuing to answer all the questions that are open, I'm going to ask that Barbara move to the next slide. Thank you. So for all things of getting our webinar slides, our management bulletins, our frequently asked questions, those can be found on the ELCD's COVID-19 guidance webpage at https://www.cde.ca.gov/sp/re/ELCD COVID-19.asp. To send and submit email questions, you can submit them to our ELCD emergency email inbox, which is elcdemergency@cde.ca.gov. There is also to find a list of the program quality implementation, the PQI Office Regional Consultants. That webpage is at https://www.cde.ca.gov/sp/ci/assignments.asp. Good to note that consultants are most easily reached by email. However, there is also a consultant of the day if you call at 916-322-6233. And I will ask that Erica and Steve come back to speak out and close our fabulous webinar.
Thank you, Alana. Thank you again, everyone, for joining. And Alana just gave you the link to the consultants, the administrators, and the GAU managers. We are always available. Please reach out to us. We may not have all the answers, but we'll find them for you. Lastly, please continue to keep yourself and everyone else safe. We'll see you in 2 weeks. Thank you, everyone.
Great. Thank you for that. Thank you, Erica. On behalf of the team at CDE, continue to work to support you all in your work to support children, families, and provider professionals. We want to thank you for taking some time out to join us, and we hope that you'll join us in a couple of weeks, as Erica mentioned, March 19th. With that, please take care of yourselves. Please be safe, follow public health guidance, and we can't do any of this without you. We're hoping that if you haven't, received a vaccine yet, that you're up soon, and we're going to get through this together. Thank you again, and we'll see you next time.